Welcome back to the show. You know, any expert will tell you that the start of good health begins with the relationship with our primary care doctor. Now, even though we know this, sometimes we don't make it a priority. So joining us now is Dr. Asra Mazhar from Overlake Medical Center to discuss some things to think about when choosing one. Good morning, Dr. Mazhar.
Good morning.
So look, I guess let's start with, where do you even start when you're trying to choose one for those who don't have a primary care doctor already?
So I think it's essential to find a primary care doctor that you feel comfortable with, that you're able to connect with, and location is so important. So finding someone at a location that's convenient for you. Most adults and children will see their primary care docs at least once a year to stay on top of those annual health screenings.
Right.
And we love to see patients more than that if there's any issues that come up.
Now, you know, sometimes people have a medical issue and they're thinking, do I go to my primary care doctor? Do I go see a specialist? How do you know when to go where?
That's exactly our job. So when we see our patients, we kind of help address all of their healthcare concerns. And if we feel that they're best fit towards a specialist, we can help get them into the right hands.
So is it kind of like you guys are the point guards?
Absolutely, absolutely.
I love it.
Yes.
All right, so we're in the new year. A lot of people start thinking about their health at the beginning of the year. How can they be better? Do you have any tips on just how we kind of can stay on top of it?
Yeah, so sometimes it's as easy as diet and exercise. So we recommend trying to incorporate at least 150 minutes of some sort of moderate intensity activity per week. And you know, you can talk with your doctor about tailoring those recommendations to you. And then diet, so keeping a varied diet, balanced, trying to keep you at a healthy weight is what's going to keep you on top of your healthcare goals. And then keeping on top of those annual health visits. So once a year, most insurance companies will cover an annual primary care visit. And it's at these visits that we can kind of run through your personal history, your family history, risk factors, cancer screenings, all those types of things.
Yeah, and I have to say, I'm still doing the math because you said how much exercise a week? I was like, how much is that a day? 150 minutes. Yeah.
30 minutes, 5 times a week.
Okay,
Yes.
I knew that. I was just kind of, yeah, that's it. Now, so you mentioned a few of the screenings. Are there ones that you really like to tell people today, hey, please do this. We're seeing a lot of this. Please make sure you don't forget this one.
Absolutely. So I think cancer screening is so important and essential to be on top of. Cancer screening will depend on your personal risk factors, family history. So breast cancer, colon cancer, cervical cancer, those are ones I'm very passionate about. But healthcare screenings, even outside of cancer screening. So blood pressure, that's something that should be checked at every single primary care visit. May not have a lot of symptoms. And just doing your cholesterol screens starting at age 20, depending on
Starting at age 20?
Yeah.
Really?
Yeah, that helps us identify. So we're fans of preventative medicine. And so identifying issues beforehand and then helping to come up with a care plan.
Am I wrong on this? It seems like that cholesterol can be sneaky because people often think, oh, if I'm exercising and doing this, then my cholesterol should be fine. But that's not always the case with cholesterol.
You're exactly right. And that's where family history can play a huge role. You may have an active lifestyle and eat a varied, balanced diet, but certain aspects of your family history can put you at higher risk. And unless we screen early on, we may never pick it up.
And if your cholesterol is high, what does that put you at risk for?
Cardiovascular disease. So that's heart disease, stroke, early death from all of those causes. So.
And I understand, again, I'm not a medical expert, but you can actually reverse some of this, right? If you do have high cholesterol, you can actually move it in the right direction.
Absolutely. There's so much to be done with just lifestyle changes. And that's why establishing a relationship with a primary care doctor is so essential, because we can pick up on those little things in your diet and your lifestyle that may be contributing to that high cholesterol.
Yeah, so if someone I know was wondering about this piece. If you haven't seen a doctor in a long time and you're just like, where do I even start?
Right, yeah. I think having an established care visit with somebody, getting to know them, making sure that you feel comfortable with that primary care doctor.
That's a big part of it. If they're not listening to you, making sure that they're going to listen to your concerns.
Yeah, I can speak for myself. That's a huge reason why I went into family medicine, is establishing those relationships with patients, because it can lead to better health outcomes for our patients.
So how can people learn more about Overlake? Because you have a lot of options there.
We do, absolutely. We have 10 primary care locations all throughout the east side. So overlakehospital.org is a great place to start. All of our preventative screening guidelines are listed there. You can schedule an appointment with your primary care doctor there, and look at all of our other locations that are available.
And that's what I was going to say. Where can you see a provider when you talk about those other locations.
Yeah, so we have Bellevue, Issaquah, Sammamish, Redmond, Kirkland, all throughout the east side. We also have a concierge clinic, a senior health clinic, and then numerous urgent cares associated with our primary cares.
What does a concierge clinic do? That sounds cool.
Specialty level care, so kind of that one-on-one, getting to know a provider, having access to that provider quickly depending on your health history.
So you have an array of options.
Absolutely.
Any final bits of advice for people?
I think, you know, I'm a huge proponent of preventative medicine. So if you're at all worried about anything in your health, stop by and see a primary care doctor, because I think that's a really good place to start, build that relationship, and hopefully lead to better health outcomes.
Awesome. Dr. Asra Mazhar, thank you so much for joining us.
Absolutely.
All right, to learn more about what we discussed today or to explore your primary care options, just visit the website on your screen. Well, no matter